Hello, I am Dr. Farangle, Senior Consultant Physician, Diabetologist, and Director Internal Medicine at Fortis Hiranandani Hospital, Vashi, Navi Mumbai. Today, I would let you know as to what does the CBC report reveals. Now, CBC is a test which has various components in it. Like we have the white blood cell count, that is WBC count. We have the RBC count. We have the hemoglobin level in that. Then we have different the components of WBCs like neutrophils, lymphocytes, eosinophils, monocytes, basophils, and so on, and also the hematocrit. Now, WBC count normal is between 4,000 to 10,000. Counts going high or low is not good. It may indicate various conditions or diseases, like commonly, for example, infection. Count coming less than 4,000 or going by more than 10,000, both can be suggestive of infection, either viral or bacterial or other problems. So that is how it helps us to know if the patient has infection. And accordingly, then we further investigate and treat the patient. So also for platelets. Normal platelet count is between 1.5 lakhs to 4.1 or 4.5 lakhs depending on the lab. In many viral conditions, like this is the monsoon season going on, where we get lots of vector-borne diseases like dengue and malaria. In both the conditions, the platelet counts gets affected. Usually the platelets are reduced in numbers and they keep coming down every day. That is why we monitor the CBC to see for the platelet count, because if the platelets goes too low, then there is a risk of bleeding in these patients. Usually the platelet count rises on its own, and if the patient is not bleeding, then we do not transfuse platelets unless the counts goes too low, maybe 10,000 or 20,000. And it is also an indication of other hematological conditions, maybe like ITP and many other problems, which we come to know after doing a further workup. An RBC count, if it is low, it can also be a marker of anemia. And also hemoglobin. Hemoglobin low always does not mean that it is iron deficiency which is causing low hemoglobin. It could be vitamin B12 deficiency, especially in those who are pure vegetarians. So accordingly, we get a basic idea as to what is the problem in the CBC, and when we do further blood tests to come to a final diagnosis, and that is how it helps us in treating our patients, and we monitor them from time to time so that they do not deteriorate or progress further to other problems.